for a dynamic life. The Jack PCL brace. The Jack PCL brace is a dynamic knee brace used to treat injuries of the posterior cruciate ligament. The problem: rehabilitation of the knee joint after reconstruction of the posterior cruciate ligament heavily loads the reconstructed ligament. The consequence may be elongation of the transplant and recurrence of posterior instability. Our solution: the dynamic spring mechanism neutralizes the effect of gravity on the calf, supporting and protecting the PCL, and as a result, posterior sagging of the knee is avoided. The principle of the brace is based on a separation between motion of rotation and translation of the tibia against the femur during flexion-extension. The translation power remains constant during the entire cycle of motion, independently of the deflection angle. The Jack PCL brace is available in two versions: the Jack PCL brace without and the Jack PCL brace with limitation. The Jack PCL brace with limitation offers the additional option of limiting extension and flexion. In order to control range of motion using the Jack brace PCL with limitation, stops limiting extension and flexion need to be positioned inside the hinge. All steps must be executed identically with both hinges. To adjust the hinge, first remove the condyle pad on the inside of the hinge. Then remove the hinge covers by loosening the screws. Metal pins serving as limitation stops are stored under one of the covers. One of the pins can be used to limit extension and another one to limit flexion. The third one is a spare. Under the cover on the opposite side of the hinge, you will find drill holes marked with degrees. Place a limitation stop in the desired degree at extension. To limit flexion, place another limitation stop into the desired position at flexion. At any time during the course of treatment, you can adjust the extension and flexion limits as required. Reattach the covers and fasten them with the previously removed screws to secure the pins. All steps must be executed identically with both hinges. Without placing the pins to limit motion, the maximum range of motion of the Jack PCL brace with limitation is 0 degrees in extension and 90 degrees in flexion. In case the range of motion should be required to exceed 90 degrees, the limitation stop can be removed with a size 2.5 hexagon wrench. Please keep in mind that the limitation stop will have to remain centered while being unscrewed, so that the hinge remains unimpaired. Before attaching the brace, the spring tension needs to be deactivated. First, set the tension lever of both hinges to minus. Push the calf shell backwards until reaching the limit to deactivate the spring tension. The spring tension will not push the calf shell forward now. To facilitate attaching the brace, set the straps to their maximum length without pulling them out of their lugs. Then unfasten the frontal straps by opening the buckles. Now take out the two frontal additional shells for the thigh and the tibia. Attach the brace from behind to the leg of the patient. Please ensure that the pivotal point of the hinge is aligned with the physiological pivotal point of the joint. The femoral rod may be set to the outline of the leg. Please make sure that the hinges are as parallel as possible to each other to guarantee functioning free of wear. The solid nature of the tibia shell without ventilation windows prevents oedemas. Position the additional shell at the thigh. Please make sure that the additional thigh shell is positioned within the lateral thigh shell. Place the distal anterior thigh strap over the additional shell and fasten the buckles. Adjust the length of the straps to align the shells parallel to the thigh. Then, adjust the length of the posterior proximal thigh strap and make sure the shells are still aligned parallel with the thigh. Fasten the anterior upper thigh strap above the hook and loop point of the additional thigh shell. Then, adjust the length of posterior thigh strap near the knee. Attach the calf shell to the patient's calf. Then, place the additional tibia shell onto the tibia and fasten the buckle over the middle of the additional shell. You may remove one of the two cushions if necessary. After fastening the individual straps, check both the adjusted strap lengths and the correct position of the brace. Please ensure that the straps are not fastened too tightly to prevent impairment of the blood circulation. Please keep in mind that the correct function of the brace is only assured when the marked straps remain fastened and appropriately tight. If one of the straps is not tightened enough or comes loose, the brace ceases to function. To activate the spring tension, and hence the function of the brace, set the tension levers of both hinges to plus. Then, push the calf shell backwards until reaching the limit. The calf shell is now being pushed forward by the activated spring tension. The intensity of the spring tension can be adjusted gradually in 15 steps, and is shown by an indicator. Set the tension spring to the intensity prescribed by the attending clinician by turning the spring tensioning screw in the direction of the arrow. Use the provided Allen key only. To adjust the intensity of the spring tension, the control knob is set to plus. Ensure that the spring tension has been activated previously. Activating or deactivating does not change the set intensity of the spring tension. The spring tension of both hinges needs to be set to the same intensity. To change the intensity of the spring tension, set the control knob to minus. Turn the spring tensioning screw slightly in the direction of the arrow using the provided Allen key to unlock it. Allow the tensioning spring screw to slowly turn back without removing the Allen key. To set the spring tension to the new intensity, set the control knob back to plus. Set the required intensity by turning the tensioning spring screw in the direction of the arrow. Before removing the brace, the spring tension must be deactivated. First, set the tension lever of both hinges to minus. Then, push the calf shell backwards until reaching the limit to deactivate the spring tension. The spring tension will not push the calf shell forward now. To remove the brace, unfasten the buckles and release the frontal strap of the brace. Remove the brace. Before attaching the brace, the spring tension needs to be deactivated. First, set the tension levers of both hinges to minus. Then, push the calf shell backwards until reaching the limit to deactivate the spring tension. The spring tension will not push the calf shell forward now. The hook and loop fastener do not need to be opened to attach the brace. Simply open the buckles and release the frontal straps of the brace. Attach the brace from behind to your leg. Please ensure that the brace is positioned on the leg as it has been fitted by the orthopedic clinician. Fasten the straps. Please ensure that the additional shells are positioned correctly. To activate the spring tension, and hence the function of the brace, set the tension levers of both hinges to plus. Then, push the calf shell backwards until reaching the limit. The calf shell is now being pushed forward by the activated spring tension. Please bear in mind that the intensity of the tension spring may only be adjusted by an orthopedic clinician after consulting with the consultant.